All right, we made it to part three, and just a little more information about gut health. Uh, the connection that you may have heard of the brain-gut connection, and our gut health is directly related to serotonin and dopamine production, and so a lot of people can improve symptoms with anxiety or depression based on their gut health, which leads us to probiotics. So we have all kinds of bugs living in our um, colon and our intestinal system all the time, and most of those are friendly bacteria, helpful bacteria. They help with digestion and they fight off pathogens and so forth. And so lots of research looking into probiotics. And so again, if that's an area of interest, especially if you're in private practice, that this can be a little side area of interest where you can become much more knowledgeable and really have that be an added service that you offer to your patients. Um, in the U.S., we have yogurt and kimchi, different fermented types of foods that are available. Other countries, for those of you who have traveled to Europe or other parts of the world, kefir is really just kind of like a liquefied yogurt, and it is very common, and also even more fermented vegetables. But that fermentation process kind of provides a lot of the same type of benefits that taking probiotics. So here's Activia and a lot of these different examples. Um, and basically, another area is prebiotics. So that's if someone's taking probiotics, they're maybe trying to add to or replace the uh, bacteria growing in their gut. Prebiotics are trying to basically develop the helpful, friendly bacteria by the different things that we're eating. So then we get to our final big part of this lecture, and that's dietary supplements. And it's basically anything that's added to our diet. Could be multivitamins, herbs, aminos, whatever it might be. It's become a huge industry, and some of the things that are taken and marketed can be very helpful, but there can be a lot of dangers as well. They don't need approval from the Food and Drug Administration. That's a huge difference between other things that are on the shelves in the United States and stores. And there are no guidelines on purity or quality, really no rules. It's just really not an area that with any type of oversight. And so there are some people who really can benefit from vitamin mineral supplements. There are some disease processes that specifically can benefit from that. Also, some people who are unable to, we talked before about accessing nutrients, and people in some situations have decreased swallowing ability or decreased mouth health, whether it's teeth or whatever it might be, that are affecting their ability to get food into their bodies, and so supplements can be helpful that way. Harmful potential could be someone who's again, decreased health literacy. They're under the false notion that they can cure a disease. Sometimes before a surgical procedure, that can be problematic. Other medications that they're taking might interact with supplements. So there are just a lot of concerns to keep in mind with supplements. And trust me when I say you will have a lot of patients ask you about different kinds of supplements. And as a doctor of physical therapy, people will come to us asking us for some of that help. The FDA estimates it's a $10 billion a year industry. The vast majority of those are vitamins. And so in some cases, what I've said to patients is, if you're not taking anything in really high dosages, the worst outcome is you'll have more expensive urine, and kind of make a joke about that. But other situations, if they're taking really incredibly high dosages, maybe that could be potentially harmful. So some guidelines, there's a USP label that will indicate that we'll talk a little bit about the USP label. We want to make sure that the word natural doesn't mean safe or better. and we want to steer our patients or steer ourselves towards things that are a little more standardized and have research behind them. So this USP is basically a company that verifies the contents of a container. So if you see that USP label on the bottle or the container, you will know that at least what it says is inside the container has been verified, and so that is a huge help right there. Just in instructing ourselves and our patients about this label can be very helpful. There's not harmful labels of contaminants, and it has been tested so that it can be processed in our bodies. But we all need to be aware they're not all created equal. There are a lot of potentially harmful situations out there. Look at how much you guys have learned about research since during undergrad and grad school, and being able to interpret research. Just because something's published even in a peer-reviewed journal, it doesn't mean that it's they've all undergone the same scrutiny. And so and that's in a peer-reviewed medical journal. There's all kinds of other quote-unquote journals and things that are out there that they are presented as though they were research, and the general public may not be able to understand the difference. And it'll, of course, be made to look legitimate, but it may not be. And so a lot of times there's a lack of a patent, or they just use a patient testimonial, which may be the brother of the company owner, right? So there's, in some ways, a lack of oversight, which can be problematic. And a lot of marketing tactics, they either don't have legit research, or they reference it or refer to it inappropriately. You see maybe infomercials, different kinds of approaches, maybe at a farmer's market or a fair, where there's not a whole lot of accountability there, that you buy it at the state fair and then the company's nowhere to be found if there is a problem or an issue. So a lot of times what most people will say, that a good healthy diet will give you all that you need, and supplements are in general not that needed. Now, of course, there are situations where that's not the case. So one additional layer of support is this natural medicines comprehensive database, and so that's another place we can direct ourselves or patients to look at. Look up the supplement that you're considering taking, see if it's in this database, and see what more you can learn about it. They have quite a few commercially available products included in this database, so that can certainly be helpful. Maybe for an individual, or even for a company who's trying to do a nutrition-based approach, they may want to subscribe to this and have access to it. So when we look at the research relating to vitamins or supplements, they did this Iowa Women's Health Study, which is a longitudinal study, and interestingly, they found multivitamins, B6, folic acid, iron, magnesium, zinc, copper associated with increased risk of death. So those are very general statements, and it will depend on many factors, but just the fact that they're finding a link between supplement intake and death risk, that's certainly not why anybody's taking a supplement. They're certainly not taking it to increase their risk of death. And so iron was shown to be the supplement that had the highest connection with death. So just important to be aware and educate ourselves and point our patients in helpful directions. Also looking at digestion efficiency. Individuals over the age of 50 are advised to consider B12 from supplements, and you see a lot of patients getting some of these injections or IVs or supplements to try and maintain those vitamin B levels. Also, women of childbearing age, folic acid is a very commonly identified a helpful supplement. And there are people who, also just talking about an individual's ability to absorb and benefit from a supplement, almost always when someone takes a large dosage of a supplement, they decrease the percentage of absorption. So Somebody, for example, taking vitamin C, a lot of times those come in 1,000 milligram tablets, and so they only, by absorbing only 15%, they get 150 milligrams absorbed as opposed to 60% of a smaller dosage. And so the more we take, the less we're able to benefit from that. And that's where some of the issues can come into play as far as people kind of over medicating, if you will, with supplements. There are a lot of, when we did our personality profiles, some of those personality profiles or types may be of the mindset that, well, if 75 milligrams is good, then I should take 75,000 milligrams and I'll be even better. And that's not always the case. You'll run into that with prescribing exercise. 3 sets of 10, well, that's probably what you'd say to a normal patient. I'm going to do 4 sets of 80. And so you have to be sure that you're reading your patient and educating them appropriately. So this is helpful just to see where nutrients are absorbed in the body. And the way to look at this is if somebody has an issue with their stomach or their duodenum or their jejunum or their ileum or their colon, these are maybe some of the nutrients that they are not able to absorb and benefit from if they have had to have, for example, part of their colon removed or part of their stomach removed, or just those areas that are not functioning properly. For calcium, there's no recommended daily allowance. All depends on that bone and tooth formation. Children have higher levels of calcium requirements, and adults, it kind of slows down and then it goes back up with older adults. Lactating females also have higher needs, basically. So then we get to the rest of this PowerPoint, which is here for your, this PowerPoint is in Canvas, and there are just a lot of assorted topics in the research that I won't go through with you, but if you have interest, there are slides talking about the benefits of nuts. And here's another video by this Dr. Greger, which again I recommend you maybe look into. A lot of interest in fish oil and its effects that are documented on heart disease and blood pressure. And so a lot of discussion about which kinds of fish, which kinds of nuts, and so forth, so you can look through all that. Recommendations for fish consumption. And so anyway, for those of you that are interested, vitamin D and some different information on vitamin D, I feel like this PowerPoint is a great resource. If you have a patient who's has diabetes, you might want to go back and look up some of this research and have that available for you. Multiple sclerosis and vitamin D, obesity and vitamin D, coconut oil, coconut milk. Again, there's a lot of these different products that can be helpful, but before we're going to get real aggressive taking much of these, we do want to educate ourselves. Calcium and where you can find it, and then calcium supplements. But in a nutshell, that wraps up our nutrition lecture, and I hope that you will go back to the very part 1, because I kind of give the overview of what the most important parts are for that nutrition quiz. Thanks so much.